We're very excited about the plans for Hardtner Medical Clinic. It's a brand new 20,000 square foot rural health clinic that's going to be constructed on the north end of our campus. We recently purchased 12 acres of property, making our entire campus 29 acres. That 12 acres is going to have our Hardtner Medical Clinic. As I said, 20,000 square feet. We're going to have a women's and children's health clinic included in there. We're going to have a specialty clinic, actually two specialty clinics, a chiropractic clinic, and an additional primary care clinic. The need arose to have additional space. In these new clinics, it's going to be much larger, the patient flow will be much smoother, and our specialists will have flexibility coming additional days during the month, having additional rooms to see more patients, and be much more convenient for our patient base. We're going to move that pediatric clinic over there, and they'll have many more exam rooms. There's also a space designed for the Kid Med program. The Kid Med program is a preventive program for children as they're growing up to make sure they get their immunizations and shots and other preventive care. A lot of times you never know when a child's going to need a physician and get sick all of a sudden. And there are times where our providers are so busy, it's very difficult to squeeze those patients in. With this additional space, it will allow for a smoother patient flow and quicker care. One of the main areas that we had not covered up until about a year ago was the women's health needs. And we were fortunate to get Dr. Joel Hall, a local gynecologist in Alexandria that is a very excellent physician, to begin providing services here. However, having the amount of space and the flexibility of seeing the patients, it has been a struggle or a challenge. We've also added a nurse practitioner, Amanda Novak, who is a board certified women's health nurse practitioner. And once we get them in a large space, then we will have a full-time women's health primary practice. Tony Finoli is doing an excellent job, and his practice continues to grow. He also is challenged with space restraints. He will have a new chiropractic clinic in the Hardtner Family Clinic. Dr. Charles Soronio recently graduated from an LSU residency program in Bogalusa. He's a board certified family practice physician, and he is poised for future growth and is a very good doctor. Our emergency room currently has 5 rooms with a possibility of up to 8 patients with one room sharing space. We have on plans to construct a 12-bed emergency room. We also have plans to develop a larger lab, a larger pharmacy, a larger imaging. We're going to construct a 10-bed day surgery unit so that we have a place for those day surgery patients. Right now we're performing in excess of 100 surgeries a month. We are a critical access hospital, so we do have a mechanism for capital funding. So therefore, as technology becomes available and it is justifiable and is medically feasible, then we're going to invest in that technology to provide a higher quality and higher level of patient care. We feel like our citizens and our community deserves just as good a medical care as they may get in Houston, Texas or New Orleans. Why should we short our patients when we have the ability to provide that technology?